Hey, Dr. David Lipman from Physical Evidence, and I wanted to talk to you about regenerative medicine. Regenerative medicine is something that's come down the pipe over the last few years here in the States, and it's something that I'm very excited about. First of all, about 5 or 6 years ago, I had the opportunity to start experiencing regenerative medicine myself. I was having some issues with my shoulders, some from previous injuries, some from just a daily wear and tear from adjusting patients. And I found PRP, which is platelet-rich plasma. And what it's doing is kind of hacking your body. You're getting blood taken, spun down in a centrifuge, which separates the platelets into a single layer. They can then take those platelets specifically and inject them at the site of a tendon issue or some degenerative cartilage, and it causes the body to send its growth factors all to that area. Now, typically the body won't concentrate platelets in the amounts that we can inject directly in that concentration, so we're kind of hacking the body to send way more growth factors in a faster time to that site. Now, more recently, they've come out with something that works a little bit better. They now combine PRP with fibrin and stem cells, which is now called PRF, or platelet-rich fibrin. The only difference is that when the blood is spun down, it's at a slower speed, so it's actually able to get a collection of not just platelets, but fibrin and stem cells. What that does is when you inject the site now, instead of it only lasting about 24 hours when you're doing just the platelets alone, it actually creates a scaffolding where it keeps those elements there for a longer period of time. So usually up to 1 or 2 weeks instead of just 24 hours. So the amount of growth factors that are going to aggregate to that area is so much more. So we have already implemented that here in the office, and so many people like me can benefit from that. Instead of looking at degenerative arthritis as an eventual knee replacement or hip replacement, we can now actually regrow your own tissue by tapping into your body's own resources. And I love it because it's very natural, and it's also, again, just using what the body already has and just kind of tricking the body of a sort into doing more than it would normally do on its own. So anybody that suffers from degenerative arthritis, torn tendons, cartilage damage, just loss of space in the joint can benefit greatly. I mean, to me, when you can regrow your own stuff, there's no better way to go.